Welcome. We're really looking forward to Leader Harris, and Dr. McKinney will handle that part of the program. I have some housekeeping details. We cast a wider net, and if there is any media attending, I just would ask, please, that this is recognized that this is an off-the-record conversation that cannot be attributed. That's the way we run our meetings. I've got a couple of updates about CCAC activities. The recovery roadmap is well underway in terms of implementation. Last Sunday was a State Street closure, and there'll be more of those. Later today, Clint will email a public relations toolkit to CCAC members that participated in Forward Together, or as it ultimately was termed, the recovery roadmap, so that you can tell the story of your participation and do outreach to media. And if you've got any questions, Clint's available to help you with that. The next program item is on July the 22nd. The Burnham Council will have a special program with the Commissioner of the Department of Housing to learn about the new Affordable Housing Requirements Ordinance. Commissioner Novera will share with the group the details of this new law and how companies can be in compliance. I know that's something that has a broad interest to our membership. Beginning in September, after Labor Day, we'll return to in-person meetings. And the way we will conduct those meetings will be in accordance with Chicago and Illinois and CDC guidance for the meetings. If we do one in Bryan Cave, Leighton Paisner, I think we'll have some plastic screens up, and we also have an ability to, they will be hybrid in the sense that people who care to participate remotely, we have somebody participating from New Delhi, India today, for example, will be able to be seen through our screen. And I'm sure that's true in some of the other venues that we'll check out and use. We're looking for hosts for September, October, November, and December. We'll take December, so you've got that covered. Another major programming event will be the Alliance for Regional Development's annual summit, which is going to take place in October this year between Monday and Friday, October 18th to October 22nd. Like last year, it'll be digital, and each one of those morning sessions will be 90 to 120 minutes each. And the theme for the 8th summit will be recovery, long-term recovery from the pandemic. We've got a lot of exciting speakers already lined up on that. And with that, Clint, I'll pass it back to you.
And I'm just going to toss it over to Dr. McKinney.
Thank you, Clint, and thanks, Greg. Good afternoon, everyone, and welcome to our July meeting. I have the honor and the privilege of introducing our guest speaker today. Leader Greg Harris was elected to the Illinois General Assembly in 2006, and he is the majority leader of the House of Representatives. He serves as a state rep for the 13th District, which includes parts of Uptown, Ravenswood, Lincoln Square, North Center, West Ridge, and Bowmanville. Leader Harris is a gay elected official in the state of Illinois who is also openly living with HIV and is the first openly gay person in Illinois to become a member of the legislative leadership. In my opinion, he is leading in more areas than just the House of Representatives. Currently, his interests and portfolio include state finances, mental health, and substance abuse issues, as well as addressing the needs of Illinois' homeless and at-risk youth, LGBTQ issues, protecting people with disabilities, nursing home quality, and affordable, accessible health care. Leader Harris, it's such an honor and a pleasure to have you join us today. I will turn it over to you.
Well, thank you, Dr. McKinney, and thank you to the Central Area Committee for having me today. It's really nice to be able to talk about some of the changes we've made, some of the accomplishments we've done in the last year, of which I know I'm proud. I think a lot of my friends on both sides of the aisle are proud on these things. But it's been a tough couple years for everybody, and we've really focused in state government on maintaining as efficient and uninterrupted an operation of government as we could during the pandemic. We also tried to effectively respond to the public health emergency, and as time went on, began to address the economic disparities and inequities that became more and more clear as the pandemic unfolded. We've been very successful in the last 2 years in helping to restore the fiscal stability of the state of Illinois. This year, we've spent a lot of time focusing on improving access to healthcare and also to bring resources to bear on public safety issues, both at the community level and the individual level. And I want to talk today about a few things in each of those categories. So I just wanted to start with fiscal stability for the state of Illinois. And we've made great strides. That's not to say we don't have a long way still to go, but we've made great strides. As of this morning, our bill backlog is about $3 billion, which is down from $17 billion in unpaid bills just a few years ago. So now essentially, for most of our bills, we're paying on a 30-day cycle and also saving over $100 million a year in interest costs for taxpayers. This year, we paid $3 billion in federal debt, repaid $3 billion in federal debt, and wiped that off the books. We've paid as a state all of our statutorily required pension obligations. You probably saw in the last 2 weeks that for the first time in a quarter century, I mean, literally the first time in a quarter century, both Moody's and Standard & Poor's have given the state of Illinois credit upgrades, which is something we've been working very hard for to make it easier for us to borrow and govern more effectively. There were no tax increases. We didn't utilize one-time revenue fixes to balance the budget. We did raise some sustainable revenue by closing some corporate tax loopholes. And also, and this is important, by doing these things, we increased, we increased the structural position of the state by about $1 billion a year for the next 2 years as well, for the next 2 fiscal years. So, all told, it's been a very good year fiscally, and we've made a lot of progress in, righting our fiscal situation. In the public health emergency, I think, Illinois has done very well. If you look at Illinois in comparison to other states, our numbers are very good. Governor Pritzker has led Illinois with science-based remediations and interventions. We listen to the scientists, we listen to the doctors, and as of last night, our case positivity rate in the state of Illinois for COVID is about 1.7%. Now, we continue to monitor the situation, especially regarding the Delta variant. And if you look at, there's some pockets, particularly near our borders, where you're seeing spikes in positivity rates and hospitalizations. And I hope, sadly, that won't lead to an increase in deaths, but it's something that we're very much aware of. Illinois is one of the few states that met President Biden's goal of 70% vaccination rates by 4th of July. And in Illinois, at least one dose, at least 70.3% of state residents have had at least one dose of the vaccine. And for vaccination rates of people 12 and up, it's 55% have received both doses. And for folks 65 and up, which are some of the higher risk categories, 74% of the 65s and up have had both doses, and 84% of seniors have had at least one dose. So that has contributed to Illinois being a leader among states in suppressing viral transmission and keeping our hospitals and our ICUs and our ventilators from being overrun and overstretched. So we're very proud of that too. In the new state budget we passed, and I talked a little bit about some of the higher level effects of it, but I want to talk a little bit about what we also were sure to fund. And we've been very consistent for several years now in increasing the state's contribution to elementary and secondary education in what's called the evidence-based formula by $350 million per year. And we've done that each year. We've not missed a payment on that. We didn't miss a payment this year also. And the idea is to meet the state's constitutional obligation of paying for most of elementary and secondary education and reducing the reliance on property taxes. So the goal is for the state to pick up more and more of the cost of education and reduce the reliance on local property taxes. We added another $500 million for the early childhood education block grant. I mean, everyone who follows the data around success for young people as they proceed through the education system and on later into life, early childhood education and early interventions are key factors in this, and we're making a lot of investments there. We made major increases in funding for mental health, substance abuse, and suicide prevention. A lot of this with one-time federal money to do some temporary boosts in communities hardest hit by COVID, understanding the mental toll that the epidemic has taken on a lot of communities. We want to essentially flood those communities with assistance, but also to build a sustainable base of increases for behavioral health and substance abuse treatment. We're putting aside special funds also for first responders, in the first responder community, whether you were law enforcement, whether you're ambulance, paramedics, hospital workers on the front line, ICU, ER docs, ER nurses, the staff who works in these facilities. Tremendous toll, especially from those who've worked consistently through this epidemic, and a lot of need for additional support, and we're going to provide that. We're making a big investment this year that we're going to continue in future years in increasing also funding for violence prevention. I mean, in Illinois and certainly in states across the country, it had been predicted that as we came out of COVID and we've seen it, there have been some upticks in community violence, and that's going to take additional interventions on all different kinds of levels. We've increased violence prevention funding by 40% to put people in the communities, to work with affected communities and groups, to intervene in violence should it occur. We've made major increases in programs for teens. And could somebody mute whoever has their phone unmuted? We've made major increases for funding for teens and youth to provide positive activities during the summer, and also major investments for summer jobs for youth. So we want to be sure we're giving young people alternatives to the streets. We're also providing additional funding for training for our law enforcement officers. We're helping communities buy and operate and record body cams to be sure that our policing is being done to the best new standards and that there is accountability and transparency. To help families come through this epidemic, we've spent over $1 billion for rental and mortgage assistance since the beginning of the pandemic. And Illinois is recognized as one of the states most effective in getting rental assistance and mortgage assistance out into the community. We're adding a new cadet class of state police to patrol the Chicago expressways. We're giving major increases to DCFS for foster families and group homes. We're investing several $100 million in our healthcare workforce, with over $150 million for frontline DD workers and major rate increases for folks in senior and home care situations. We know we got to put a lot of people back to work, and we budgeted $1 billion to accelerate capital projects across the state in roads, bridges, broadband, water, sewer, lead pipe replacement, and mass transit to begin to put more and more people back to work. And I've got some time left. I was not watching the clock. The other thing that we're spending a lot of money investing in this year is technical assistance for community-based programs who have a hard time accessing state, local, and federal grants and funds. We know that a lot of the most effective organizations are grassroots community organizations, but because of their small size and some of their newness, they don't always have the ability to do the grant applications, the compliance, the reporting, with their staff. So we're standing up community navigator programs to help those folks who are doing the really good work on the streets to also apply for and get support from the state of Illinois and other other government entities. We're putting $350 million into business interruption grants. There will be a new round of business interruption grants announced soon. In addition, we have dedicated funds for our hospitality, our tourism and convention, hotel industries, because we know that, again, it's one of the most important employers in the state. We've got to do everything we can to bring tourists and bring leisure travelers and bring conventions and meetings back into the state of Illinois. We're making major investments in revitalizing arts, culture, and museums, huge drivers of employment, huge drivers of tourism, and other sources that pay a lot of tax revenue into the state and employ a lot of people. We're paying hospital stability payments. A lot of the hospitals, due to revenue loss in the state, found themselves having some financial troubles, even some of the larger systems. So, to help alleviate those troubles and get them, sort of over the hump of COVID, we're providing stability payments to, eligible state hospitals. We're setting aside special funds for our safety net hospitals and rural critical access hospitals that provide services in lower income communities or high Medicaid populations. So I'll just wrap up with a couple things here and then turn it back over for questions. But one of the other things that just became so clear to me and others as we went through COVID was how we need to change and reimagine healthcare, in our state, and how it's delivered and how folks get access to it, how it's convenient to them in their communities, and how the level of care, the access to specialists and quality care is consistent across the state and not just dependent on which zip code you're either fortunate enough or unfortunate enough to live in. And you've seen the studies of how, just within a couple miles of the central area of downtown, life expectancy can be 7 to 10 years different due to a lot of social determinants, but also due to accessibility of quality, affordable healthcare. And so we've been very intentional in beginning to make the investments this year as part of a sustained multi-year program in re-envisioning healthcare with our partners in both the hospital industry, the community health centers, the FQHCs, with local providers, with advocacy organizations like the Shriver Center and others, to begin to relook at what should we be doing now to prepare our communities to have the best healthcare for the future. And that's both a financial commitment, but it's also a policy commitment. And we've begun some of the policy work this year by, the governor will sign this bill shortly, which would require insurers, both public and private, to continue to pay for claims processed on telehealth platforms as the public health emergency ends. And for a lot of us who've been now getting our health care virtually in one way, shape, or form, it's sort of slipped a lot of folks' minds that this is a development for most people that came with COVID, that there were not structures in place for insurance companies to pay or for parity in how they're paid with in-person visits. And when the public health emergency ends, so would the ability to access telehealth. So in the state of Illinois, we've been working with the provider community and also with the private insurers and the public insurers to craft a law that will allow telehealth to continue and provide services, also provide payment parity and payment surety for the different providers. We're putting restrictions on abusive prior authorizations by insurers. So any of you who have ever been to the hospital and you may have gotten an order from your doctor to go for a particular test, like an MRI or a CAT scan. You may have gotten a prescription drug, and you also may have gotten from your insurance company, a requirement that has to be prior authorized. we're, cracking down on that to be sure that when prior auths are used, they're used for medical purposes and not simply to drive down costs by denying or delaying necessary and appropriate care. We're implementing a number of policies to reduce prescription drug pricing to the consumer, and also to eliminate anti-competitive practices at the retail level. We're reducing significant numbers of barriers to opioid treatment that exist. A sad side effect of COVID has been a resurgence of substance abuse in general, but particularly abuse of opioids like fentanyl and heroin. And we're really working hard to reduce as many barriers as we can. So when people decide they want treatment and they need treatment, they're going to be able to go and get treatment close to their home, something they can afford, and not have a bunch of obstacles and walls thrown up at them. To attract and retain the best workers in healthcare, we are raising the rates the state is paying to our home healthcare workers and our senior home care workers, and realizing we've got to stay competitive in the marketplace. And as we go through all of these things, we're also keenly aware that if we do these things right and if we do them smart, not only can we get industry buy-in, we can attract substantial federal matching funds. We can essentially get 50%, 50 cents on the dollar if we from the federal government to pay for these if we do it in a planful, smart way. And that's also something we've been focusing on to make sure that these plans we're making and these changes we're implementing are going to be sustainable for the future. So that's healthcare, fiscal stability, response to the pandemic, continuity of government, and some of the investments we're making to continue to make Illinois a way better place to live. And happy to answer any questions.
Fantastic. Thank you, Leader Harris. And as expected, the questions have been rolling in. So I will just tell you, because I've been monitoring those questions. And as a reminder, members, you can feel free to place your questions in the chat and I will pose them for you. But just the questions that we have, Leader Harris, so far, 3 themes are emerging. There's a question about COVID, a couple of questions about our credit rating, and then a question about the speaker election. So I'll start with the COVID question. And the question is, Illinois was very aggressive in fighting COVID with mask mandates and business closures that hurt our state's economy. Was it worth it? And is Illinois bouncing back faster than other states that perhaps did not shut down?
This is one of those questions that can be very tricky to answer. We saved a lot of lives in Illinois. We saved a lot of people's lives in Illinois, and our hospitals were not overrun, our morgues were not overflowing. And to me, saving those lives was just a very important thing. And inevitably, there were businesses that suffered from this. I think we all know that suffered from some of the shutdowns. I think that for years, historians and public health specialists are going to be looking at Illinois and looking at other states and trying to determine, what lessons are to be learned, what was right, what was wrong, in how different states handle it. Those like South Dakota, who just were wide open. You see Missouri next door to us, who was far more open than Illinois, same geography, who still to this day don't have enough capacity in their hospitals or emergency rooms to treat their own citizens. So I think history will be a judge of how well we did, but I think we did the best we could in the circumstances, and we have a lot to show for it.
Great, thank you. So the next question is about the credit rating. So the rating agencies, as you said, have upgraded our bond rating. Do you think that means our financial problems are finally behind us?
I think we're now starting to look at them at the rear view mirror. But like I said at the beginning, there's a lot more work that needs to be done before we can have bragging rights about we've solved all of our problems, because we still haven't. we still haven't. We still have a lot of work to do on, paying down pension liabilities. That's certainly something that is at the forefront of the state. Also making sure that as we plan for the future, and we know that there will be some inflationary push each year, that we maintain our we maintain our finances at the point where expenses do not exceed revenues. So there's still work to be done. And I think, if you look at what the credit rating said, they point out, there's still some pitfalls potentially ahead for Illinois and, a lot of other states too, as we see what the economy does and what COVID does. But, for the first time in a quarter of a century, I think we're being told we're back on the right track.
Fantastic. Thank you. So here's one that hopefully will be a little lighter, but I don't know, who knows? What was it like to run the election for the new speaker?
Well, you have to be able to count to 60. That was the first requirement. To count the winners. But all kidding aside, we're at, this was, so much change happening so fast in state government, in fact, all levels of government. This was one more complication. I mean, this was in the middle of a pandemic. People were suffering, families were suffering, hospitals were overflowing still at the time. We were in the midst of the top level of mitigation. A lot of businesses were suffering, still are suffering. So, that was sort of an insider baseball thing to have to choose a new speaker. And I'm glad we got it done quickly and effectively. And, Speaker Welch is now, leading us in a new direction that, has led to us, improving our credit rating, sort of stabilizing our economy and beginning to turn around a lot of these, healthcare issues.
Great, thank you. Here's another COVID question. How has your job changed as a legislator with COVID? And how are you staying in touch with or how did you stay in touch with your constituents when you couldn't attend events and, the remote voting and things of that sort?
Well, how I stayed in touch with my constituents, my area of town, we have a high area, we're an area with a high uptake of tech. We have good broadband connectivity. So it accelerated a trend that, we had been seeing gradually happening up here in my area and how I communicate with constituents, where now it's on different messenger platforms, Facebook Messenger. I talk to more constituents there than email or in person. But that was a trend that started that just got accelerated. And that's fine. I think you do lose a lot by not doing things in person, though, especially with groups. And where we saw that in particular was getting testimony from folks in committee hearings while we were looking at legislation in the budget. You've probably all been in these meetings where people now have multi-screens. They're not just multitasking; they're on multi-screens, and stuff is happening on both sides of you. And if you're not paying real close attention, some of the information slips by. And this may be, sort of old-fashioned, or there is a word for it. I can't remember the word, but this may be sort of old-fashioned. There's something to be said for having people come and sit in front of you and talk one-on-one, where your attention is fully devoted to what they're saying. You can see their body language, you can see their emotions, you can see their families sitting behind them, and get a more full message of what they're trying to communicate.
Sure.
Luddite, I think was that the word I was trying for? Who's got a dictionary?
I don't, but I will tell you, I'm guilty of the multiple screens. It helps me with my multitasking. This next question actually comes from our chair, Greg Hummel, and his question is, what are some of the innovations that may occur with federal and state expenditures in infrastructure spending, such as for climate change mitigation measures or interstate compacts or anything else that you can think of?
Well, I think, we're going to see what happens in the next couple of weeks with the federal infrastructure bill. I mean, that's the big one of the big debates in Washington, along with the voter rights bill right now.
Mhm.
But I think if there's a sort of more philosophical discussion around infrastructure, and you'd never think you're going to have a philosophical discussion around infrastructure, but I think it's the question of, is infrastructure roads and bridges and water and airports, or is it human infrastructure? Is it childcare? Is it access to broadband? Those types of discussions, and that's raging in Washington right now. In Illinois, we've done both. We've done both. We've made major investments in childcare. We've made major investments in mass transit. We're making major investments in our roadways. Logistics is a huge business for the state. Keeping our ports open and getting our rail, the CREATE program to get the rail lines unclogged, to keep our interstates in good shape. All important things for us to do.
Okay, so I have two questions in the queue, but the last one I have to just ask that first. When is the next vaccination lottery drawing?
Well, I don't know, but I'll Google it and find out. Karen, can you find out when the next? Karen's going to get online for us and find out when when you have to go get who's not vaccinated, who wants to go get a shot. That's what I want to know.
Exactly. So I'm assuming that all of our
July
members
19th.
know this.
Mark your calendars, July 19th.
July 19th. For those of you that don't know, the state of Illinois had a lottery drawing for people getting vaccinated for COVID, and the top prize was $1 million. They announced a winner just last week. So that's why we want to know. But on a more serious note, Leader Harris, you've been a champion for LGBTQ rights. As you look back on that journey from the past 20 years, what thoughts do you have on how far we've come and how far do we have left to go?
Well, I mean, when I ran, for the first time, one of the first things I said was, I think we should have same-sex marriage in Illinois. And essentially, lots of people just sort of smiled and patted me on the head and said, good luck with that. Maybe that will happen in your lifetime. It happened a couple years later. And I think there's a lot to be said for the activism that went into the marriage equality movement and the LGBTQ movement just in general, that has really changed hearts and minds of people. I don't think most people realize it's less than 10 years ago that same-sex marriage became legal in Illinois, that we were the last state that was able to do it legislatively in the country, that eventually no other state could pass it at the time. It was still considered that controversial. And then the Supreme Court came in and made its decision, and now it's the law of the land. And you talk to a lot of younger people who are not learning LGBTQ history in their schools, and they're like, isn't that quaint? We thought we could always get married. There's sort of a lack of realization sometimes how far we've come. But then if you look in the last couple of years at sort of a fight that a lot of folks are having now, which is trans rights, it's following in the same paths that marriage did. If you remember, back before the marriage movement really, took off across the country, in a lot of national Republican campaigns, same-sex marriage was vilified and used as a wedge issue to divide voters, culturally back then. And now you're seeing, trans issues being used by same groups in the same way to frighten and divide voters about, the trans athletes will be, competing against your kids. Trans people are going to be in your bathrooms. I'm sort of happy to say in Illinois, that has not taken hold as much as in some areas. We pass, when a trans issue comes up on the board, I watch the board now and see, there are Republican votes. These things are passed on a bipartisan basis. And I think that's good. I mean, I think it shows a lot of progress that we're moving in the right direction.
Great, thank you. Could you speak a little bit to the ongoing energy dialogues in Springfield, like CEJA and the fate of our aging reactors downstate?
This is an ongoing discussion. And the question is, CEJA is the Climate Energy Justice Act. So I hope I got the acronym right. Climate Energy Justice Act. And it is one of the proposals about statewide energy policy that's being debated and negotiated in Springfield. It's a really complicated bill. It deals with issues not only of renewable energy and climate change. There's also an aspect of it where Exelon Corporation has said if they don't get a subsidy of a certain size, that they're going to decommission and close some of the nuclear reactors in the state, which provide a lot of our base energy needs. There is an entire solar and wind component to the discussions where those industries are jockeying for position. There's also a very important equity component to be sure, not only in areas of jobs and employment and business opportunities that Black and brown communities are given full participation, but there is also the climate justice aspect of closing plants that have been for generations polluting in largely Black and brown communities, and how do you remediate those plants, how do you replace those jobs, and how do you restore some sense of justice to communities who suffered those ill effects. So and then of course, labor is very concerned about maintaining jobs at prevailing wages also. So it's a complicated negotiation. It's still going on. The issues are fairly well, I'm told, whittled down to just the last one or two, but those are the most contentious. So it goes on.
Thank you. So we're going to switch topics a bit and talk a little bit about the arts. So you mentioned increased investments in the arts, culture, museums, and tourism industries. What do you hope for the role of the arts, culture, and museums in a post-pandemic world?
Yeah, I think we got to do everything we can to restore that sector of our economy to a fully functioning and vibrant state. If you look at a community like mine, a lot of the businesses, we have a lot of businesses up here who are oriented, or hospitality businesses, and also oriented toward a lot of crossover between our arts and cultural institutions. We have a lot of small theaters in the neighborhood. The Old Town School of Folk Music up here, where thousands of people come for classes and come for experiences. We have a lot of museums, especially a lot of museums of different ethnic and cultural minorities, and all those are really part of a vibrant patchwork that's our community, and we don't want to lose them. And I've been working with the Arts Alliance and some of the music venues and some of the bigger museum organizations to build support among my colleagues to be sure that as we decide where we're going to spend very valuable dollars, that we spend it there also. If you look at where tourists and conventioneers want to go, a lot of them are our music venues, a lot of them are museums and theaters, dance. If you look at the big shows downtown, Lollapalooza and others, they fill up a lot of hotel rooms. A lot of people go out and spend money in the community. So it's just a critical infrastructure to invest in.
Agreed. Thank you. So we are at the 12:40 mark, and I would just invite any of our members that have any additional questions to please send them forward. Leader Harris, I've exhausted all the questions that we had, so we will give it about another minute to see if anyone else has anything else. But in the meantime, I would ask you, Leader Harris, if there's anything else that you'd like to share with us today. Perhaps something has been triggered from some of the questions, or if you thought about anything else while you were speaking.
What I remember was in our prep call, Greg Hummel saying, don't be afraid to end early. You don't have to talk the whole time. So
that's right. That's right. Greg did say that. So just Two other quick things have just come in. One says, sending a shout out for experimental station in Hyde Park, perhaps high-speed rail. Have you heard any discussions around that?
Not about a Hyde Park station. I have not, but if whoever has the question, I'll put my email in the chat. If you send the question to me, I can look into it.
Fantastic. That's wonderful. What's next for, no, actually, let me do this one first. This is a follow-up to the CCAC question. Do you think CCAC will prevail? Will the energy discussion carry over to veto session?
Hard for me to say when those negotiations will conclude. There was a hope that it would be done by the 4th of July. That was, among some of the negotiators, that was their plan. That didn't work out. So it's hard for me to pin down a date.
Okay, got it. And I will just note for the membership that Leader Harris has put his email in the chat. So for that high-speed rail question, feel free to reach out. And then I'm going to go to our final question, and I think it's quite appropriate that we end on this topic. What is next, in your opinion, for HIV/AIDS advocacy? And how have people with HIV dealt with COVID?
Well, if you look at, I was looking at it's called the Morbidity and Mortality Report. It's a CDC document, and I was looking also that talks about death rates and disease rates for various conditions nationally, and then also looking at the HIV numbers for the state of Illinois and the city of Chicago. And I think COVID, from a healthcare perspective, has pushed a whole lot of issues out of the forefront of people's minds that are still out there in the community, still need to be addressed. If you look at particularly young African American and Latino men, the incidence from, say, the 14-year-olds to the 34, 35-year-olds is still increasing. It's a leading cause of death still. So it is disproportionately impacting some communities, Black and brown communities, poor communities, worse than others. But also heart disease, obesity, diabetes, those are still plagues, those are still pandemics, they're still out in communities affecting a lot of the same folks. And that's why we're making investments in reducing those disparities, as well as just looking at COVID in isolation. That's
right. And if anyone else is interested in the report that Leader Harris mentioned, it's the MMWR, the Morbidity Mortality Weekly Report. It's a report that CDC issues on a weekly basis, and as he said, they cover a multitude of health issues, but it's always full of data and statistics and analysis on disease trends that they're seeing across the country. Looks like we did get one. Oh, thank you, Adrian. Adrian just put the link to the CDC's MMWR page in the chat. Okay, Leader Harris, I promise. We just got a final question in. It says, how does Illinois' enhanced financial situation improve Chicago's critical financial condition?
I think that, I don't want to overstep my knowledge here. I think, the fact that, our credit rating has gone up is certainly beneficial to other government entities and municipal entities in the state's credit rating. Chicago being the size it is, I don't know if that directly affects it, but there are other local government entities around that it will help. But also, our increased revenue is a boon to the city, because about 10% of the income taxes that come into the state of Illinois go into what's called I think it's 10%, the local government distributive fund, which then would come back to the city of Chicago. And that was worth, I think this year, in the vicinity of another, several $100 million for the city of Chicago.
Fantastic. Well, Leader Harris, you've shared so much with us today. You've just been a wealth of information. And on behalf of our membership, I would like to thank you for all of the insights that you provided to us today, all the information you shared with us. I've certainly enjoyed hearing you speak and just listening to the discussion afterward. With that, I'm actually going to turn it back over to our chairperson, Greg Hummel, who has some additional information to share with us this afternoon.
Thank you, Suzette, and thank you, Leader Harris. Chock full of information, delighted that you were able to impart as much as you were able to do and answer our questions. So I'm going to tease the audience. We have a new executive director. That person will join us on Monday. We're working out the final contract details. This person has national experience, connections in Washington, has worked in both the private and public sector, and we are delighted to be able to make the formal announcement. First day on the job is Monday. First convening of this group is Monday, August 10th. We don't normally have an August meeting, but we will have an opportunity to then in person after Labor Day. So we're really excited. I'd like to do a shout out to Kim, who's on the line, Kim Dowdell, Tyler Meyer, Julie Taylor, Matt Dumich, and Andrew Broderick, who were part of the search committee. And so a lot of hard work went into it, and we are absolutely delighted with the choice, and I think you will be too. I'd also like to make the point that Clint Sabin and Five Star has been invaluable and will be playing a continuing role in the future of this organization. So I can't thank him enough, and he was the reason that Leader Harris spoke to us today. So Clint, thank you for that. Exciting times ahead. Suzette will let you get to your next meeting. Thank you for moderating today, and we will see you all after Labor Day in person. Enjoy your summers, and thanks again for participating today.